It's my honor to be here at NCHPE as well as to give this oration. I think Dr. Mahdi Hasan, though I have not met him, I read a lot about him. As he said, he was an anatomist and neuroscientist, and he was awarded as many awards. He was a great researcher, neurotoxicity. He was member of the NAC committee and National Education Policy expert in 1990, and he worked till almost 2012. And he had multiple international collaborations. He had the book also. So many, I think, it's worth remembering. So today, actually, I'm going to speak today on artificial intelligence, what I have learned in last few years. And if you know, artificial intelligence has already entered our life. As soon as we enter the airport, we go through Digiyatra. We have films which are purely now international AI. We have face detection, we have everything which has come, and AI has entered our life from Google Map to Digiyatra. If you look at AI and PubMed, there are 2,01,705 articles, and out of that 41,000 are in 2024. Look at publications. If you just put AI and medicine, I mean, it is amazing. The way it is coming, we get lost. All of us get lost. We have no driver taxis today, and I'm sure this is now a reality. In many of the countries, I think this has come. We have AI and robotics. This is where the AI will tell you which area I need to dissect with robotics. This is going to be a game changer for me. As a surgeon, this is going to make my life much easier. AI in education has come in a big way. I'm sure we saw a lot of simulation. Lucina, this is called as, and many of the institutions have Lucina, where you see how the delivery can take place, and the whole Lucina will deliver. You can put everything in this, whether you can put it rotated, non-rotated, you can say shoulder dystocia, breech, everything will be shown. You can teach our students, you can add anything, and the baby will be born.
Hello, everyone. I am Mira, the medical information robot at AIG hospitals. I have been meticulously designed to assist doctors, empower nurses, and most importantly, ensure that patients receive information in a faster and better way. I will assist patients and healthcare professionals. My goal is to enhance patient experience with human oversight. I will be joining the AIG Live conference being held at HICC Convention Center in Hyderabad. I hope to see you there and interact with you.
This is AI health communicator. I'm sure patients and relatives will love to talk to her than the doctors, because she's so beautiful and she talks so nicely. And she has been now trained into AI. And now there are many more things, and this is already existing in India, in Hyderabad. And I think the way you look at it, the way language you speak, we have completely changed. Having said that, let's come to the health professional educations. AI in education has come in a big way. Intelligent tutoring systems, collaborative learning systems, curriculum personalization. We are all talking about now personalization. We are talking about management, automated easy examinations, learning. I think we can have huge scope of AI in education has already come. How to use AI apps for research? It itself, you look at it from ideation phase to hypothesis phase to outlining phase to structured content phase to ethics generation. There are enough number of AI. I'm sure last 2 years I have gone all over India and talked about all these aspects in various big institutions about research and education, conducted workshops. So, having said that, what have we learned over last 10 years? Now this is what I'm going to really talk today. I'm not going to talk about AI use in HR. I'm going to say what lessons I have really learned. The first lesson is AI augments and does not replace. I think this is the first lesson I want to say. Efficacy in augmenting, not replacing the human roles. Now look at, in medical education, AI-driven simulators enable students to practice clinical decision making, but rely on faculty to interpret complex results and build bedside manner. Now this is where the role of a teacher exists. Look at this journal, Frontier in Robotics and AI, October 22, they wrote a very nice article, Human Augmentation, Not Replacement, a research agenda for AI and robotics in the industry. And very well they said that there are two major dimensions. One is called as an development, other is called as an action selection. And what we need to balance is how much AI is going to empower you versus how much it is going to mechanize you. And it's a balance between empowerment and mechanization really tells you like whether it is assisting you or it's automating your technologies. And this is where you need to really select and take your institutions further. Now look at, this was about 3 months or 4 months ago, within AI Enhanced conference, somebody talked about DNA nudge technology, which has now come to treat diabetes and control diabetes, what is called as nudge avatars. Now this is a new thing in AI, where you are now trying to control diabetes by avatars. Now even DNA news technology, there was a very nice review they really made, and it says that still needs a clinician to self-manage diabetes and diet of patients. So in spite of all AI trying to help you, the augmentation has occurred, but you need still a doctor support. Histopathology, Nature 2024, it has made a tremendous difference, AI in histopathology. AI can assist in identifying patterns quickly, but human experts are needed for final interpretations and patient interactions. AI methods for histopathology, which promise to yield accurate and scalable results, I think you will find it's extremely necessary. Radiologists still need to validate this finding. Today we feel that radiologists will supply. We'll talk about it more. But radiologist also, you need somebody human behind that computer. The second lesson which I learned is AI makes life easy for teachers and students. I think I would like to really make it very clear to you. I am of the opinion that AI should be used by teachers, but there are a lot of caveats. So we'll talk about it, what are those caveats. Don't be so rigid about the idea that I'm not going to use AI. AI makes life easy for everything, creating summary, making lectures, idea generating, researching, writing manuscripts, everything it can really help you. There are so many sites, SciSpace, SciSite, they're all academic kind of AI bots. These are not routine ChatGPT. There's a world beyond ChatGPT. Please understand this. Many of them are free, many of them have low cost, so we can really use this. You can do a self-paced learning. We are all talking about self-paced learning. Simulated patient cases, exam preparations, and data interpretation skills. All this AI can do it so quickly. The World Forum suggests there are 7 principles of using AI in education. Purpose, knowledge, integrity, evaluation, compliance, balance, and agency. Now, what questions it raises? Will AI increase cheating in assessment? Everybody worries. If I bring AI, will it cheat? Will students cheat me? Cheating in examination is a social problem. It's not a technology problem. People have changed, technology has changed, but cheating has remained. There are newer methods of cheating students have found out. How will you build learning support systems where students do not have to cheat? That's the question we have to ask. Assessment is prone to error. Assessment suffers from a threat to validity because of the errors inherent in process. AI detection, AI submissions can remain undetected and may score higher. This was the latest article, up to 16%. So move from information to wisdom. Assessment needs to move from trying to evaluate what information students have in their heads to what they can do with that information. It's like an open book exam. You already give information is possible. See what can they do about information rather than asking them information-based questions. And this is the first thing you should really change. Don't use assessment design to solve AI problem. Use AI to solve assessment design problems. That's the change we should bring as teachers into AI. Give you an example. Where is the line differentiating between your knowledge and the skills and the AI? Better question is, what real world problems did you and AI solve together? So you try to give them, build an app for marginalized. I'm just giving an example how the many other industries have changed. So we also need to change the way we examine. Data quality is crucial. That is the third lesson I learned. AI systems are only effective as the data they use. If you're using ChatGPT 3.5, you will get up to 21. If you're using 4, you will get it updated. We don't know when 5 is coming. High quality, representative and well curated data sets are necessary to ensure accurate outcomes. AI can make errors. AI is not foolproof. Please go away, don't go with the idea that AI is everything. AI can make many errors if the data quality is poor. AI model overestimated predicting heart disease risk due to the reliance on outdated data sheets. This is a European cardiology review. You know, artificial intelligence can make wrong. All that glitters is not gold. That was the tie. Trust but verify. Generative AI is biased. Don't consider AI is also not biased. In diagnostics, AI models can misdiagnose if they're trained on databases. You will find many times the databases are from samples, they are from students, they are from the racial communities, so they can be biased results. In fact, AI algorithms used in healthcare risk assessment tools showed racial bias because they were trained on a biased historical data. AI-powered diagnosis like IBM Watson for oncology depend on comprehensive, high-quality data sets. You know, it showed erroneous treatment and therefore it has a limited or incomplete data sets. So it can have a cognitive bias, algorithmic bias, lack of complete data. Most psychology research studies include results from undergraduate students, which are a specific group and do not represent the whole population. So think about it when you are going to do this. There are many other biases like historical, sample, label, aggregation, confirmation bias. This is another big bias which AI can have. And there's enough articles to really prove what I'm really trying to say. The fourth lesson which I learned is ethics first and technology second. Whenever you are using AI, try to be ethical. There are always privacy and data issue. I have seen many of our students try to put their whole thesis into ChatGPT. Remember, you are exposing it to the world, your original work. Be aware of privacy. Be aware of data leaks. Bias and fairness, transparency and explainability, clinical validation and regulation, and professional responsibility. Who is going to take accountability if AI goes wrong? Is my patient, if suffers, am I going to bring AI in court? People have brought it into court, but nothing has happened yet. So ethics and privacy concerns, there are enough amount of now general data protection regulations. There are so many compliant kind of those which are coming up. You know, as the AI science grows, there are a lot of other things also growing. Many students and faculty today use AI for education and research. What question we have to ask is, how do we maintain academic integrity while using AI? Am I faithful to myself when I am using AI? So you bring originality in assignments, citing AI assistance and disclosures, avoiding over-reliance on AI. You know, nowadays people put everything on Claude and ChatGPT. Institutional guidelines for faculty and students, continuous ethical reflections. One of the, I wanted to really tell to the all vice chancellors that every university should now develop guidelines for AI use in their institutions and their universities. When used thoughtfully and ethically, AI can be invaluable to medical education, but using AI to enhance learning while cultivating skills in critical thinking, problem solving and maintaining integrity, we need to balance. Sometimes there's the issue of losing your creativity. So there need to be plagiarism check, guidelines, disclosures, and start training from your school. You know, about 3 months ago, my granddaughter, who is in the 6th standard, came to me with this chapter, which says, Introduction of AI Ethics. And I was so surprised that she had a chapter on ethics in AI. I think we need to start from our students, from a very school level, so that they understand that AI is not everything, and there has to be an ethical issues with AI. And I'm happy that the schools have already taken this as their own chapters. University guidelines for AI use have come. Cornell University has come. I'm sure many universities have come out with such guidelines. ICMR as well as National Strategy for Artificial Intelligence, there are many guidelines that are coming. But I would urge that many universities and national level, we need now guidelines for AI in education and research. Lesson 5th is personalization over standardization. We are all talking about standardizing education. It's time that people have to use their abilities and their pacing where the AI can be of a great help. Adaptive learning platforms like Smart Sparrow use AI to personalize medical educations today. and allowing each learner to work as his own space. What I'm worried about, will this work in a high volume setups like in our country? Our setup is too big. Crores of students, will they be able to cope up? Time saver, not skills replacer. AI-driven tools like surgical black box record analyze surgical procedures to identify errors. I think there are enough papers which I have really spoken where I can find out what is the AI analysis of this person's movements and how I can improve them by giving him particular kind of exercises. What is the lesson 6? Increased AI-generated publications. I'm going to see all of them are going to have AI-generated publications. AI will have an impact on scientific research process from copy editing to drafting literature reviews. I think all editors have already started worrying about, I'm getting reviews which are already AI generated. It is important to be transparent about to what extent AI is and will continue being used, especially with scientific research and publications. Rising AI generated papers. This was a wonderful paper which came and it showed that how 22 to 24 AI generated papers have come. And they have come in all categories. Computers, medicine also, you can see some of these papers. Should we be alarmed? Not so much right now, as many of these AI generated articles have 0 citations. But I'm sure they are going to increase. Larger number of scientific papers written by AI assistants today. A recent paper monitoring AI modified content at scale estimated between 6.5% to 16.9% of the text submitted as a peer review to several AI conferences to have been. So people have been using 1 out of 7. Medical Education, our journal, 4th November, Kevin Eva, our editor, wrote an article that medical education and artificial intelligence, responsible and effective practice requires human oversight. AI holds immense potential in medical education and publishing. Its responsible and effective use demands consistent human oversight. So what I want to again emphasize is that AI is going to affect your publications, but be careful when you are reviewing and looking at this literature. AI and empathy. Will it really change? Empathy cannot be automated yet. Virtual patients powered by AI, such as those used in standardized patient programs, offer a platform for practice. But the nuances of real patient interaction, especially emotional responses, require human healthcare providers. So we still require human healthcare providers. Will AI replace teachers? This is a question I want to ask. All of us are worried whether AI will replace our teachers. AI is not a magic bullet that fixes every problem, but it will partially replace physicians. And how? So I went into more deeper into this. Which specialties will get affected more? That's the question all of us should ask. So there was a very nice paradigm I got. There is a very nice framework it really gave. There are 2 ways you should look. One is interaction based with specialties which are there, where talking with the patient in person or remotely makes a lot of difference, versus data-based specialty, where dealing with the data about or derived from the patient. This was the one paradigm which was working. And crossroad was repetitive, a large amount of job is same day if you are doing, versus you are doing a creative work. This was another paradigm. And now they're trying to put this paradigm. And this was a wonderful paper by Mesco. And what he really did, he tried to develop digital health technology will replace physicians. This is the title of the paper. And what he really did, he divided all the specialties into these 4 categories. And what did he really found? That limited role, auxiliary tools like geriatrics, dental, ENT and pulmonology, repetitive tasks replaced by AI, spaces for creative tasks like dermatology, radiology, ophthalmology. There are repetitive tasks. So this is what we saw in COVID. Many of the X-rays were read by AI. Not much affected are neurology, psychiatry and general practice, endocrinology. Because there is a human interaction. Though endocrinology will have some nudge out us. AI-dependent technical specialties, work with them like surgery, sports medicine, and partially AI-dependent are cardiology and GI. And I must tell you, this is a speculation. This can go wrong. But there is some science in this. There is some rationality in this.
So we need to think what is going to happen after a few years and how are you going to really see these specialties affected by AI. AI and imaging, radiologist versus artificial intelligence. This is a question we should ask. But my answer is very simple. Prepare for new roles, not fewer. AI in radiology such as Zebra medical vision algorithm for reading CT scans enhances radiologist work, require them to develop new skills in AI interpretation and decision making rather than replacing their roles. So we as a teachers need to change our role. As a teacher, as an examiner, as an assessor, we need to learn this and become smarter than students so that we know how they are doing it. If you depend on students to do everything and we remain behind, we will never be able to catch them. So we need to go one step ahead. So if you look at AI and imaging, AI will not replace medical professionals. However, medical professionals that use AI will replace those that don't. That means today I need a radiologist with skills of AI rather than only radiologists. I can assure you this, after a few days you will have an advertisement where they'll ask you, have you got any course or degree into AI? And that's not very far. I think we should be all prepared because we need to change our roles and see that we are going to be different. Future, strategies for integrating AI. Integrate AI into curriculum. Its time has come when we should integrate AI into curriculum. Ensure students understand its capabilities, limitations, and ethics concerns. That's our prime. We need to think how would we maintain academic integrity of our whole system even if the AI has come. Healthcare professionals should develop digital and AI literary skills to effectively leverage this technology. Develop ethics guidelines for AI use in induction. Universities to establish clear policies on AI use in assignments, exam, and research projects. Now today I'm sure I work for many universities and like Tata Institute of Social Science, they already have now Turnitin and everything, all these programs where any assignment which comes goes through it and it will analyze it and then only it will come to me with the report so that I know how much of AI he has used, how much he has disclosed. So now these things are becoming better. But I must tell you, our students are smarter. Sometimes they may bypass all this. Promote ongoing dialogue between educators and AI developers. Ensure AI tools are designed to meet specific needs of education. AI possible future. You know, I don't know how many of you really read, but meet India's first AI school teacher. It has already come in Kerala and Bangalore. They're already there. You see YouTube videos, how the new teacher has come, which is AI based. And she is teaching classes, regularly classes. So AI teachers, AI hospitals. China has already opened the new hospital of AI in June 2024. It's purely AI based. Only, I think, physician comes there, rest all is AI based. And I think you can go on net and see it. It's all there. I'm not talking something which is off hat. AI generated research proposals are judged by AI. Funded projects will be lead to AI generated manuscripts. AI assisted reviewers. Published studies are read and digested by AI. And AI proposes next steps for research. This is all going to come. Whether you stop, you discuss everything, but this is going to happen. What is the risk of AI in professional education in our country? Loss of critical thinking skills. This is what everybody is worried. Am I making my students lose his own critical thinking skills? Over-reliance on AI may hinder development of problem-solving skills. So we need to be more smarter. We need to ask better questions to students which will stimulate his problem-solving and critical thinking skills. So it's a challenge for us. Oversimplification of complexity. Reducing complex nature of practice to bullet points. This PowerPoint also made that. And I think it caused many times the death of education. So maybe AI is also going to create bullet points from a complexity of our clinical scenario. Widening the gap between education and clinical practice. Already we have too much of gap. So I think AI enhanced education might misalign this practice. So conclude, AI has come to stay. You cannot go away from AI today. We have to accept that AI has come. Embrace technology with ethics and academic integrity. Be more forward. I think understand that we have to be academically integrated at the same time ethical. I must tell you, these slides are not made by AI, which I could have easily made. Technology should be essential part of practice and education. Clinical medicine is very good, but today we also need technology to confirm, treat, and remain legally safe. Embrace technology while staying humane. Don't lose the human component of our clinical medicine. That is what has kept us for so many years. So I would like to show gratitude to many, and I would like to say that thank you and have a great time. Thank you so much.